Asha Sproles, and I'm here for the Clinical Competency Practice
So
Exam
it's
Day,
really
and I will
just
be
visual.
demonstrating the head
Like
to
the
toe
way
exam.
chest and all that.
So to begin with,
I'm
I'm going to speak to our patient, so I'm going to introduce myself. My name is Asha. I'm going to be your nurse practitioner today, and we're going to do a head to toe exam. So we're going to start. Can you tell me your full name? Brittany. And your date of birth? 2787. And what year is it? 2018. And can you tell me who the president is? So by her telling me that, I can say the patient is alert and oriented, speech is clear, judgment's appropriate, her mood and affect are appropriate for situation. She maintains proper eye contact with me with the examination. She also, her dress is appropriate for the season. She is well nourished, and we can say that no acute distress is noted. So I'm going to go ahead and take a look at your head and scalp, if that's okay with you. Okay, and just tell me whenever I palpate if you feel any tenderness, okay? So the head we can say is normocephalic, it's atraumatic. Her scalp, any tenderness? No. So there's no lesions, no masses noted upon palpation of the scalp. Also, her hair is evenly distributed. Looking at her face, we can say that the skin is clear, it's unblemished, there's no lesions noted, there's no nevi, no scarring present. Also, her nose is midline, her lips are symmetric with no facial droop or anything noted. I'm just going to palpate your frontal and maxillary sinuses. Are they tender at all? No. So no tenderness noted upon palpation of frontal or maxillary sinuses. I'm just going to feel your temporal artery. So temporal artery is palpable with no thrills noted. I'm also going to feel your temporomandibular joint. Tell me if you feel any tenderness. So temporomandibular joint is without any clicks or tenderness noted. I'm going to have you raise your eyebrows for me really tight. Okay, shut your eyes really tight. Okay, can you smile really big and puff out your cheeks? So cranial nerve 7 is also intact. Also, just by looking at her face, we can see that there's no involuntary facial movements noted. We're going to move on to the eyes. We can see that her eyebrows are normally distributed. The hair is evenly distributed on the eyebrows. There's no lesions noted on her eyelids. There's no ptosis of the eyes. Her eyelashes are evenly distributed. There's no drainage coming from her eyes. The sclera is white. Her corneas are transparent and smooth and shiny. The irises bilaterally are flat and round. I would say 2+ in size bilaterally. Your conjunctiva is pink and moist bilaterally. Okay. And then I'm going to have you, we're also going to test your extraocular muscles as well as your eyes and your vision, okay? So can you cover your left eye for me? Okay. Hang on. Okay, tell me when you can see my finger, okay? Okay. Okay. Okay, cover the other eye for me. Okay, so cranial nerve 2 is intact. I'm going to have you follow my finger, just with your eyes, okay?
Always remember to inspect first.
Okay, so extraocular movements are intact bilaterally. And that's also cranial nerve 3, 4, and 6, which are intact. Okay, I'm going to have you focus on something far away for me. Okay, and then look back at my finger. Okay, good. I'm going to shine this light into your eyes, okay? Just focus, just look at the eyes. So your corneal light reflex is symmetric bilaterally. I'm just going to take a look, shine this. So pupils are equal, round, and reactive to light bilaterally, and they're also reactive to accommodation and to direct and consensual light bilaterally. Okay. Also, we're going to go ahead and take a look at your fundus.
And we only do percussion over the posterior.
We'd have to dim the lights, but in here we can't really dim them.
Anterior.
Okay, so I'm going to go ahead and take a look. Okay.
Yeah.
I can't. I can't.
Anterior.
Okay. All right. We're going to look at the other one. Hold on, let me find it. Okay. Okay, so bilaterally, her fundus is of red color, retinal color, or the fundus is red in color. Her disc margins are sharp bilaterally. There's no signs of any hemorrhage or papilledema noted of her eyes. Okay, so moving on, we're going to take a look at your ears. So we're just going to look at the outer surfaces first. You can see they're both symmetric on her face. The skin is in uniform color to her face. There's no lesions noted on the ears. I'm just going to feel any tenderness. So no tenderness noted of her auricle or tragus is bilaterally. There's also no drainage coming from her ears as well. So we're going to go ahead and take a look inside.
She has some scattered nevi again. Small bruise area. Actually, this right here, I don't even know where it came from. Good cap.
Are we ready?
Yeah.
Okay, so just looking into her ears at the tympanic membranes. So tympanic membranes are pearly gray in color. They're intact. The light reflex in the right ear is noted at 5 o'clock and at 7 o'clock in the left ear. There's no redness or fluid noted in the internal ears. Going back, we're going to take a look at your nose. So we can say nose is symmetric, midline on the face. Is there any tenderness? No. Okay, so no tenderness noted of the nose upon palpation.
Right, and I'm going to try and break your fingers.
The nostrils are patent bilaterally. We're going to take a
Now,
look at
try and push against my fingers.
So the septum is midline, and mucosa is pink and moist. There's no sign. The turbinates are not bleeding. They're smooth. There's no polyps noted inside the nose as well. I'm going on to look at her lips. We can say that the lips are symmetric. They're pink. They're moist. There's no cracking or lesions noted. No facial droop of her lips. We're going to take a look inside. Say "ah." Can you say "ah"? Okay. Lift your tongue up for me.
We go up to the
Look at your gums.
come up to the front for me.
Okay, so looking inside of her mouth, the buccal mucosa is pink and moist. Her tonsils are +1. The uvula is midline. There's no signs of any redness or inflammation in the throat. The teeth are without decay. Her gum lines are tight. There's no retraction noted, no bleeding, no swelling of her gums. Her tongue is pink, moist, and kind of rough in texture. The palate is smooth and moist. Also, the floor of her mouth is shiny and moist and pink. There's no lesions noted of the floor of the mouth as well. Okay, so now we're going to go ahead and look at your neck. So looking at the neck, we can say that it is symmetric. There's no visible lumps. There's no visible pulsations noted. There's no palpate your trachea. Trachea is midline. We're going to also feel your carotid pulses. So carotid pulses are 2+ bilaterally. Okay. I'm also going to take a listen to assess for any bruise.
I'm just on the wrong side.
You're supposed to really take a deep breath, exhale, and hold
You
it.
just turn your head slightly to the side.
Okay.
The jugular
And let's do the other
pulsation
side.
is
Take a deep breath.
present.
Exhale and hold it.
It's way down.
So no bruise are present
I mean,
bilaterally
it
of the
would
neck.
be like maybe at 1 centimeter.
Okay. Also, I'm just going to palpate your lymph nodes so you can tell me if they're tender at all. Okay. So this is palpating of the preauricular, postauricular. This is occipital.
No, we'll do the.
This is submandibular.
So I would look at your chest and
Submantle.
say, she's got some
This
scattered
is
nevi
anterior
in the
cervical.
skin of the thorax, but no heaves.
So lymph nodes are non-tender upon palpation and also mobile. Okay. Also, we're going to check your thyroid.
No
So if you
pulsations under the skin is
Kind of
warm
tilt your
and
head
dry
to
and
right
warm.
for me.
Okay.
So thyroid was smooth without any or any nodes or goiters present. Okay, we're also going to check your range of motion and your muscle strength of your neck. Okay, so can you flex your head back for me? Touch your chin to your chest. Okay, touch your ear to your shoulder, and then other ear to your shoulder, and then turn side to side. Okay, and then I'm going to have you press against my hands. Okay. Back. And then
Maybe we should ask them for help.
resistance. So she has full range of motion in her neck. There's no tenderness noted or no crepiness noted, and no limitations. And also muscle strength of the neck would be 5 out of 5. That's her skin color. Normally she would not have her shirt on, but given our clinical placement setting, we are going to keep her shirt on for those purposes. So we would look at the skin condition of her back. Skin would be appropriate for ethnicity. There's no nevi noted on her skin or any lesions. You would look for scarring. Also, you would look for bruising, things like that, or skin discoloration. Also, I'm going to look at her neck and shoulder muscles, and we can see that they are symmetric. I'm also going to palpate her spontaneous process, which is straight. Okay, and then can you take a deep breath and exhale? So chest expansion is symmetrical on her. Looking at her AP to transverse ratio, we can see that her AP diameter is less than her transverse diameter, which it should be. We're also going to note her breaths, her respirations. It should be anywhere from like 12 to 18 is normal. Given this time, we won't really go, I won't assess your breaths, but you can tell by just her chest that it's non-labored right now. Also, we're going to check for tactile fremitus, so I'm going to have her say 99 for me. 99, 99, 99, 99, 99, 99, 99, 99.
You have light,
99.
both sides.
99. So tactile fremitus is not present, and vibrations are symmetric in all lung fields. We're also going to percuss. So I'm just going to make this up a little bit. So we're just looking for some resonance.
So you're saying like hit it like this? No.
From the side. Coming from the side. Like this.
The aorta is auscultated, no brewing. Listen to the renal arteries here.
Yeah, because if you have it
Here,
here.
you're gonna get, I got you.
Brewing
Side right
renal
there.
arteries.
And then
Can you listen to iliac?
see.
So we heard resonance is present in all lung fields. I'm also going to go ahead and percuss for her CVA to see if her costrovertebral angle, if she has any tenderness. So whenever I palpate you, or percuss you, let me know if you feel any tenderness, okay?
She was like this. How long was she?
So the CVA is non-tender up on percussion. We're going to go ahead and take a listen.
Good resonant sounds, no timpani or dullness in all 4 quadrants.
Red reflex.
Now, we percuss the spleen and the liver stuff is in the special stuff, not in this.
No, you're palpating for the liver.
Do I start off with a right to my eye? Like a lead, or do I wait till I see the light in there?
So this
Oh,
would be,
there
can you
goes.
take a deep breath in for me?
Oh,
The liver is palpable,
Right side of my
about
Like this.
3 centimeters.
When you do,
oh no, right.
when you're doing the right eye. You're
Should be
doing
your right
And
hand,
then-
right?
right hand, right eye. Because you don't want to switch it with you.
Spleen is non.
You want
We're
to
going to also
get
listen
Just
on
gonna
your side.
gently touch on your lips and tell me if you have any tenderness or pain.
But it's going to get dark, but
Okay, we feel a little bit deeper, same thing, let me know if there's any tenderness or pain.
where you're at in relation to the patient, then you just do right hand,
Okay, no
Right
tenderness
hand,
in all 4 quadrants,
right
no
eye,
palpable
right eye.
masses,
kind
no
of come in and pump up, get the red
organ
reflex, and once you get the red reflex, then you move in and look. Okay. So I usually have mine set. I look at my hand, and these little lines, and I have mine set.
Ask her about that, is that supposed to be percussed?
It's about the same distance.
on there, okay.
So breath sounds are clear to auscultation in all lung fields with no adventitious sounds present.
This is, I'm gonna have to press.
I'm glad I came.
Yeah.
So we're just percussing her CVA for any tenderness. So let me know if you feel any tenderness.
Let me see if I can bump somebody.
So CVA is non-tender by ready?
They have to.
All right, so looking at her upper extremities, we can see that her skin is appropriate for ethnicity. It's warm and dry to touch. There's no visible bruising, no scars, no nevi noted. There's no swelling noted of her extremities. I'm just going to palpate her radial pulses. They're 2+ bilaterally. And I'm just going to palpate over her hands and her finger joints. So does that hurt at all? Any tenderness?
So I use the big stick.
Okay, so look at this hand as well. There's no swelling, no redness, any tenderness.
Close your eyes.
So no swelling or tenderness of her hands or her finger joints. So we're gonna go ahead and have you, we're gonna test range of motion in your shoulders, okay? Well, also, hang on. So we're gonna look at her nails. So you can actually see that her nail beds, they are tightly adhered, or her nails are tightly adhered to the nail bed. They're round and smooth. The nail folds are. The nail edges are round and smooth as well. There's no clubbing present, no swelling of the fingers. They're appropriately groomed. She has on nail polish, but you would check capillary refill. It should be less than 3 seconds bilaterally. We're gonna go ahead and also check range of motion. So I'm gonna have you, okay, put your arms back behind you, okay, and then up over your head. Okay, go back behind your back, and then you do underneath, and then up, and then behind your head. Good. Okay, put your arms down. Do a shoulder shrug. And then I'm gonna have you put your arms up, press down. So she has full range of motion in her shoulders with no crepitus noted. There's no deformity of the joints. No tenderness, and then muscle strength bilaterally would be a 5 out of a 5. I'm going to go ahead and just palpate the elbows, the joints of the elbows. Any tenderness? Okay. Any tenderness noted? So there's no tenderness, there's no deformity, no swelling or inflammation noted of the elbow joints. I'm going to go ahead and have you flex your arms for me. Okay, and then down. Like extend up, extend down. Okay, and then you're going to pronate over and supinate for me. Okay. And then also we're going to test strength, so hold your arms up for me and then push against me. Flex. So she has full range of motion in the elbows as well. There was no tenderness noted, no crepitus, and muscle strength would be 5 out of 5 bilaterally. In the hands and wrists, we are going to go ahead and have your hands up. Okay, you're going to flex back.
And then touch my finger.
Okay, go back
Touch your nose.
straight. Put your hands, fingers down, go back up.
Finger.
Okay,
Nose,
you're gonna go in,
nose, finger,
go out.
nose, finger.
Spread your fingers for me, make a fist, and then do this. Good. Okay, also grab my hands, squeeze real tight here. Okay. And then I'm gonna also have you pull.
Take your heel and run it down your opposite
Okay,
shin
good.
from top
So
to
of the hands and
bottom.
wrists, she has full range of motion with no limitation noted, and muscle strength bilaterally would be a 5 out of a 5. And that's for your upper extremities. Okay, we're going to go ahead and check for her jugular venous distension. So I'm going to have her lay back at a 45-degree angle. And if you can just tilt your head to the left. So we're just looking for this pulsation here. And then back over to the right. Okay, so jugular venous distension is not present bilaterally on her. Okay, we're going to go ahead and have you lay back. Okay, and just looking at her, we're just going to assess her skin characteristics. So there's no scars noted, the skin is warm and dry to touch, there's no, it's appropriate for ethnicity, there's no scars, no lesions noted on her skin, and we're just going to palpate with your foot.
You got good reflexes.
So there's no visible or no abnormal pulsations
We do it
noted.
on this side just to make sure.
And I'm just going to go ahead and take a listen.
This one's right here, right?
So you have your right heel.
And we're going to listen over, this is the aortic, pulmonic, this is Herb's point,
We got to the bicep too.
So you have your right heel, right heel.
this is tricuspid,
Oh, I got you. Where that right,
and then her mitral valve.
okay, with the leg reflex.
And we're just going to go ahead and listen for a minute for her.
When you see your first open eyes,
I'm doing a little bit, but I'm not getting that full on. There we go.
Go back to work tomorrow. You guys are getting full assessments
So
all
responsive
Like
reflexes,
integrity, I would say.
dependent reflexes, I'm gonna have you lay down again.
Scarring.
Oh.
Say 2 o'clock or 1, 10 o'clock.
And then,
Okay.
sometimes
so
it's
how many grades, it says grade.
So 1 + 2 + 3.
So our able
So 2
to
plus
pulse
would
is
be normal.
72
Yeah,
beats
those
per
are
minute.
mine.
Yeah.
You know, on that video.
I'm just going to listen to the bell,
That's what I bet.
and we're going to go over the same points for able to.
Yeah.
We're going to listen to pulmonic, her Herb's point,
Yeah,
and then tricuspid.
I can tell some of the students that are having.
Okay, and then I'm going to have you turn over to your left side for me. And we're going to listen to the
I'm gonna have you lay down for me. Do your Babinski here.
Oh, yeah.
Freckles.
Good. And then I'm just going to feel. So if you can take a deep breath and inhale. So we're trying to palpate your apical pulse, and it should be like at the mid-clavicular, at near the 5th to 4th intercostal space, and you should feel like a short tapping sensation. And I can feel it right here at the 5th intercostal space. It's about 2 centimeters deep.
It's a big deal.
And you can lay back over. Okay, and that concludes the heart examination. I'm afraid I'm going to leave something out of this one. Okay, so we are going to assess her abdomen area. So right now we're just looking at her skin characteristics. We're looking to make sure that her skin is uniform in color with the rest of her body. It is appropriate for ethnicity. It's warm. It's dry to touch. She does have a few scars. That's what you're looking for. Surgical incisions. There's no jaundice. We're looking to see if it's distended. Any fluid present in the abdomen, which hers is not. It's flat. Her abdomen is flat. We're going to look at symmetry. So her abdomen is symmetric. Her umbilicus is inverted. It's midline in the body like it should be. There's no discoloration of her umbilicus or redness noted. Next, we're going to go ahead and listen to her bowel sounds in all of her quadrants.
Yeah, the tongue depressor. I would always open it like, you know, if I had it open.
It's really not.
So bowel sounds are present. They're normal active in all 4 quadrants. The next thing we're going to do, we're just going to percuss over her abdomen. Here, we're going to turn this down just a little bit.
Yeah, it was a little tough. It was a little tough to see.
So we're just listening for resonance, which you can hear, that hollow sound. So resonance is heard in all 4 quadrants. Next, we're going to go ahead. We can percuss over the liver, so you're going to go.
What's heard in all 4 quadrants?
Resonance, right? Timpani? Timpani. Yeah, resonance and timpani. So we're going to go ahead and percuss over her liver. So we're going to go from a timpani to a dullness. So right here was like her dullness, and it was heard. So her liver span would be about this. If I had a ruler, we could measure. Her spleen, you're also going to kind of percuss over it as well until you go from timpani to dullness, which on her is like this, approximately this large. We're going to go ahead and palpate to light and deep palpation. So tell me if you feel any tenderness. Okay. And then we're going to go a little deeper. Any little tenderness? Okay. So she does have a little bit of tenderness in the left upper quadrant, but normally they should not have any tenderness in any of the 4 quadrants upon light or deep palpation.
An easy way to remember the sound in the, I remember timpani, tummy.
That's what I was
Okay. Okay.
Yeah.
We're also going to go ahead and listen to her, and we're listening for any bruise. Also listen.
Tonsillar, submandibular,
So there's no bruise present over the aorta or your renal arteries. You can also go ahead and palpate for the aorta and note the pulsation. So it's about 2 centimeters wide, and it's
Wow.
You'll see a lot of
And I think that concludes the abdominal assessment. So I'm going to have you take a deep breath and exhale.
What do they usually call you?
So no, there's no signs of hepatomegaly. Her liver is more palpable. Okay, and then we're also going to go ahead and palpate for her spleen. So take a deep breath and exhale. And her spleen is also non-palpable as well, which there's no signs of splenomegaly present. I'm also going to go and palpate your kidneys, so tell me if you have any tenderness.
I'm sorry. always red.
So her kidneys are also non-palpable and there's no tenderness noted. Patient. So now we're going to go ahead and assess her lower extremities. So we're just going to feel for temperature. You're also looking for edema, so there's no edema present in her lower extremities bilaterally. Her skin is warm and dry to the touch. Bilaterally, there's no scarring, no varicose veins are present. Also, we're going to go ahead and palpate over her toes and look in between. We're inspecting for like redness to make sure her skin is intact. So there's no redness between her toes. She does have surgical scars bilaterally on both feet. Also, we're going to go ahead and, which she has toenail polish on again, but you would also assess for capillary refill, which you can do it on the ends of her toes. So capillary refill is less than 3 seconds, also bilaterally. Also looking at the toenails, you can see that her nails are tightly adhered to her nail bed. The nail folds are rounded and smooth, and also her nail edges are rounded and smooth bilaterally too on her toes. Okay, and then we're going to go ahead and feel for your popliteal pulses.
Because it's just kind of like, how in-depth does it need to be?
You have to make sure that you've hit all of
Yeah.
the items.
Well, but some of them are like, it will say, check range of motion and strength of hands.
Or upper extremities.
Upper,
Bend your leg
Upper
for me.
extremities, okay. And what some people will opt to do is you, yes,
And
you
then we're
can,
gonna
you can change
feel
up
for
if you want to
posterior
and do the
tibial.
strength for everything. Or some people find it more easy to just,
And then-
they kind of memorize it in order and they're coming from head to toe.
So,
and there's nothing wrong with
her pulses are 2+
I'm just gonna show
bilaterally.
you. Okay.
We're going to go ahead and have you lay down. We're going to check your range of motion and your muscle strength. Does this come out? Yeah. Okay. So we're going to go ahead, we're just going to palpate over the hips.
I want to offer two
So
things.
does this hurt at
okay?
all?
Because
Okay.
if you're
So I'm going to have you bring your leg all the way up.
And
That's if you have a ring on and
down.
everything.
Exactly.
Okay. Take your knee into your chest. Okay, you're going to internally rotate, externally rotate. Okay, bring
I
down.
want you to hold your arms out.
Right, and now you're going to adduct. So bring it away from the body and then to the body. Okay, and then also you're going to do the same thing to this leg. Okay, go ahead, hold it up. Okay, and then bring it to your chest.
Okay, let's see, for the legs, okay, let's see how strong your legs are, so.
Okay, and then bring it away from your body and in. Okay, and then press up against my left, or my hands. So, okay, and then press it, push against me.
Good.
Okay, push
I'm
against me.
going to, and you've got to brace yourself,
Okay,
because some of
push
these
against
guys
me.
will send you across the
Okay,
room.
and push against
I want
me.
you to push out, push,
Good. So she has full range of motion in her bilateral lower extremities with no limitation. Muscle strength of her hips are a 5 out of 5 bilaterally. Okay. And then also, I'm going to have you bend your feet up and then down, and then internally rotate and externally rotate, and then press against me and pull. Okay, good. So she has 5 out of 5 muscle strength bilaterally in her both feet, and also full range of motion bilaterally with no limitation. And there's no swelling or anything. This is her.
Well, because you can do like, pull my fingers apart, push them together.
So there's no swelling, deformity over her knee joints as well as bilaterally in both feet. So that concludes the lower extremity examination. Now we're going to go ahead and test her neurological assessment. So we're going to go ahead and test her
This is a whole
sensation in both of her feet. So you're going to use a sharp object and also a dull object. So you can tell me if this is sharp or
I know,
dull,
well, that's the
okay?
thing, like, we've been, I'm such a big, I like sharp. Yeah, but I was like,
So position or sensation is present in both feet. Now we're going to also test the position sense of her toes. So I'm going to have her, this is up and this is down. So close your eyes and you tell me if your toe is up or down. Okay. And this is up and down. So tell me which position. Good. So position sense of toes is bilaterally intact. We're going to go ahead and test her cerebellar function. So I'm going to have you touch your nose and my finger rapidly. Okay.
But you know the technique.
And then I'm going to have you run this heel down this shin. Okay, and do this heel to this shin. So her cerebellar function is intact. We're also going to go ahead and test her reflexes. So this is your tricep.
See, but that one would be, that's like another, this is your,
This is your
posterior.
bicep.
always like offset.
This is
So you're, because you've got, you know, you've got your
Regular
major
vagus.
pathways, you've got a pathway here, and you've got one here. So you'll see, like if, like let's say, this would be the bottom of my foot, so if they have
This is your
diminished back here,
bicep.
you would see like,
And then
sometimes
this
you'll
is the
see like
brachial
ball of the
radialis.
foot,
We're gonna
you know,
check.
pat of the toe kind of injuries, and if it's this one that they have a
And then the
blockage in, that's where you see the toes won't have hair. They won't have hair over the top of their feet, and they'll get these kind of an end of the toe.
So good, deep tendon reflexes are 2 plus bilaterally.
The arterial.
Then the vibration sense.
And
we use
shiny,
our
you know, the
tuning fork.
shiny.
And we're just gonna make sure that she can feel the vibration in both of her feet. So we're gonna strike her to see that. Okay, so now we're gonna test the vibration sense in her feet. So I'm just gonna strike the tuning fork. Can you feel it? Yes. Okay. Good. So vibration sense is intact bilaterally, and that concludes the neurological exam. Okay, so now we're gonna do her musculoskeletal assessment. So I'm gonna go ahead and have you walk straight, and then when you turn around and come back, you're gonna walk heel to toe for me. So we're just looking at her gait to make sure it's smooth and coordinated and her balance is intact, which is good. Okay, now I'm gonna have you walk a little bit on your tippy toes. Okay, and then you're gonna come back on your heels. Okay, good. And then you can hold on to right here, and we're gonna have you flex and extend your knee. Okay, and flex it back, okay, and then do a shallow knee bend. Okay, and then do the other side for me. Okay, and a shallow knee bend. Other side. Okay, there you go. Good. Okay, also, I'm gonna have you stand with your feet together, hands down, and then we're gonna close your eyes for 20 seconds. Okay, and we're just assessing.
Well, it just says you're feeling the head and feeling the face. And you can have purpose like over the sinuses as well if they were like really.
So Romberg is negative. Okay, and I'm gonna have you bend over and touch your toes. And we're also looking to make sure that her spinous process is straight and there's no curvature. Okay, go ahead and bend up. Okay, I'm gonna have you bend backwards just a little bit. Hyper, go back a little bit. Okay, and then go side to side, side and side. Good. And can you twist? Twist for me. Okay, good. So musculoskeletal, her strength, it would be a 5 out of 5. All of her movements were smooth and coordinated, and her balance was intact. And that concludes the musculoskeletal assessment.